And then one of the emerging areas for some of our members is going to be the rise of rural generalism. Within rural faculty, we're tremendously excited about the opportunities that this brings, and we have now got AMC accreditation, and we're looking in conjunction with ACRM to really roll out rural generalism in the years to come. What do you see the place of rural generalism being within our college, within our profession?
I think that this is an enormously important and positive story for general practice. I'm extremely proud of what an Australian rural generalist is. And so I think this is to be celebrated. I think that rural generalism is one of the ways to strengthen rural general practice in our country. The reason for that is that, first of all, we've got RGs with fantastic advanced skills that serves their communities. Now, one of the problems I see with that is we're still needing hospitals to embrace GPs, treat them with respect and recognition, and give them places within hospitals with which they can use their advanced skills. So we know that, for example, many RGs struggle to use some of their skills in palliative care or in anaesthetics because the hospitals are not willing to open the doors to them. So that has to change, and that requires political will. In Victoria, as you know, I've been very concerned for over 6 years about some of the relationships between hospitals here and rural GPs. And after 6 long years of advocacy, I have an agreement from the Department of Health that we will put a GP onto every rural hospital board in recognition that we need to shift the attitude towards general practice in rural areas and embrace the RG and what GPs can do in terms of hospital care. So this is all very positive. One of the things that we need to bear in mind, however, is GPs do the majority of their good work in the community. Patients want to be in the community. It is cheaper and more acceptable to everyone to be cared for in the community. And that's why we do have the Colin Grove Agreement, which really is a fantastic concept that needs to be universally deployed around Australia, because it is the mechanism by which we will be able to bridge general practice with hospital care. The RG that's moving seamlessly between hospital and community is the way that patients too will be able to move between the two sectors without falling through the cracks. And that will bridge some of the traditional issues that we have with communication continuity of care. But also the RG will be able to advocate for what general practice is capable of, so that the hospitals and the general practices can collaborate more closely, which is in the best interest of the patient.
Absolutely wonderful. Thanks so much for that, Anita.